Well, good afternoon, everyone. In addition to Dr. Ezike, we're joined today by Matt Charles, our Laboratory Director at the Illinois Department of Public Health, and by Brigadier General Richard Neely, our Adjutant General of the Illinois National Guard. Today marks 10 days since our last update on testing at these press briefings. If you recall, I used that briefing to highlight our current capacity and laid out our plan to reach 10,000 tests per day, the number of tests scientists and experts say that we need to understand more fully the virus's presence in our communities across Illinois. Folks, I promised you honesty and transparency in every step of our COVID-19 response, so here it is. We have only just recently surpassed 6,000 tests, and we will not reach the 10,000 mark this week. Today, I'm going to lay out exactly why that is, the work that's been done to increase testing over the past 10 days, and what we plan to do to get to our goal as quickly as possible. 10 days ago, I presented a roadmap showing how we were going to get to our goal within 10 days. The path that I laid out for you had as its key element the addition of new laboratory automation machines to add a multi-thousand unit daily increase to our state labs. To get this done, we partnered with a major supplier of molecular testing equipment, Thermo Fisher, which is a global provider of COVID-19 testing solutions to state and commercial laboratories. Thermo Fisher, like many companies, provides testing processes that are regulated by the FDA and are authorized under an emergency use authorization to provide COVID-19 testing to customers like the state of Illinois. So we acquired 5 high-volume RNA extractors from Thermo Fisher, each of which promised to run 200 tests per hour, and we distributed those 5 machines across our 3 state laboratories. Some quick math will tell you that these extractors could increase our testing output by thousands per day when running effectively. Over the past 10 days, working alongside experts from Thermo Fisher, we are still not getting the level of output that we want to see from these machines. More importantly, these tests are not producing valid results in a way that meets our exacting standards. I am as impatient as the rest of you are, wanting to increase testing, but I will not sacrifice accuracy for the sake of speed. These tests and the results they will provide are too important. We have to get this right. We're working around the clock alongside Thermo Fisher to accomplish our goal, but until these challenges are overcome, these machines will not be part of our testing capacity here in Illinois. 10 days ago, I said to you, every day we aren't hitting 10,000 tests or more is another day that we're not able to get the answers that help us get past the current crisis. So today I'm standing in front of you and saying we are not there yet. Folks, I want to be clear with all of you that we are choosing the best path, but not necessarily the easiest path. If we wanted to choose an easy but less effective path, we could increase testing capacity through private labs used by the federal government. The problem is those labs take 7 to 10 days to produce a result. People can end up on a ventilator before they ever get their testing result. That's just not a timeline that I want to bet on. When we produce accurate test results at our own state labs or at local hospitals, we get results within 2 days. No matter how much is beyond our control, the buck stops with me, and we are still not where we need to be on the testing front. So here's what we're going to do. Instead of solely relying on federally sanctioned labs to save us, we're charting our own path forward. I'm putting my faith in the scientists and technicians, the academics and innovators here in Illinois to expand our test results. Our state is nationally and globally competitive in just about every category of research, science, and technology. We've already relied upon those resources in our fight against COVID-19. Illinois was the first state in the nation to validate the original CDC COVID-19 test back in February. In the United States, only the CDC has been testing for COVID-19 longer than the state of Illinois. And teams at universities and research laboratories statewide are already working toward treatments, preventions, and cures. We've already led the way on state-level testing innovation in the United States, and we're going to do it again. Our researchers are working in an expedited fashion to get this additional new testing up and running as soon as possible and distributing it to other institutions beyond our state labs that have our same type of equipment to continue increasing capacity statewide. To ensure a steady stream of supplies, our in-state universities and local laboratories are creating our own raw materials instead of relying upon the global supply chain, which is, frankly, in disarray. Our institutions are developing and distributing their own viral transport medium, known as VTM, and the necessary reagent locally. Hospitals and labs in Illinois that are running low on VTM will be able to access these resources through their local emergency management agencies' resource request systems. We're now running 3 shifts at one of our state labs, with the other 2 moving to match their capacity soon. And more than 96 locations across the state are now collecting specimens. This capacity has brought us the increase that we have already achieved. Today, we surpassed 6,000 tests in a 24-hour period. We also need to talk about rapid tests. As I've told you, I spoke directly with the president and the CEO of Abbott Labs the night that they announced their portable 5-minute rapid test for COVID-19, and they expressed their genuine interest in taking care of their home state. And for that, I am very grateful. They dedicated the supplies to support more than 88,000 tests a month, or around 3,000 tests a day here in Illinois. And we've seen the documentation as to where the distributions of those items are headed. Unfortunately, it is our understanding now that the federal government redirected most of these early tests to private systems without our state input about where the tests would make the most impact. That said, we believe this new test capacity will begin to show up in our numbers as soon as these labs start to utilize their full capacity. Our teams in our state labs also received 15 Abbott ID Now machines from the federal government, for which we're very grateful. And those machines are being distributed to every state in the United States, 15 machines. This could be a huge help, but there's a catch. The federal government included only 120 total tests. That's 8 tests per machine for all of Illinois. But I assure you that we will leave no stone unturned to get the tests that we need to run those machines at full bore. I lay out these obstacles not to complain or to point fingers, but to be fully transparent with all of you as to the challenges that we face and how we are working to overcome them. It's on us. I'm also hopeful that this transparency will shine a light on some of what's taking place across the country and will encourage the White House to remove the obstacles that are blocking our path forward and to work together. Meanwhile, we are using every resource at the state level to increase testing and are continuing to make progress, though frankly not at the rate that I would like. I want to end my portion of today's press conference with some exciting good news. 2 weeks back, we announced a multi-million-dollar Illinois COVID-19 response fund to support community organizations and local nonprofits around the state, working to support the residents who are hit hardest by COVID-19. This morning, the fund announced its first round of grant distributions, $5.5 million to 30 organizations that serve families across 96% of our state's population by providing people with access to food, shelter, healthcare, help with their mortgage and utilities, and focusing especially on supporting vulnerable populations like our children, our seniors, those with disabilities, immigrants, victims of domestic violence, and others. In sum, these organizations serve more than 700,000 people. In just the last few weeks, the fund has raised more than $28 million from nearly 2,000 donors, and many more rounds of funding will be coming soon. I'm truly grateful that this money is getting out to our communities so quickly. Individuals and families in need of support should visit the same website as the interested donors do, and that's at ilcovidresponsefund.org. That's ilcovidresponsefund.org. So thank you, and now I'd like to turn it over to our IDPH Director, Dr. Ngozi Ezike, for today's medical update. Doctor?
Thank you, sir. Good afternoon and happy Passover to those who will be celebrating that starting this evening. I want to start by talking about a test that was recently authorized by the FDA that detects antibodies created by a person in response to the new coronavirus. This blood test detects antibodies in persons who have been infected, not the actual virus. Isolating them from those who are not infected. Antibody tests will play a critical role in the fight against COVID-19 by helping with identification of people who have actually overcome must continue to be the way that we reduce the spread of stop now. Let's be all in, Illinois. We're going to get to the other side of this pandemic and all be able to celebrate whatever faith we celebrate together soon. And with that, I will summarize comments in Spanish. Buenos tardes. Quiero comenzar hoy hablando de una prueba recientemente autorizada para su uso por la Administración de Drogas y Alimentos. Esta prueba detecta los anticuerpos creados por una persona en respuesta al nuevo coronavirus. Este análisis de sangre detecta anticuerpos en personas infectadas, no detecta el virus. Una distinción importante, ya que estamos enfocados en encontrar personas positivas para COVID-19 y aislarlos contra los que no están infectados. Las pruebas de anticuerpos son críticos en la lucha contra COVID-19. Va a ayudar a los médicos a identificar a las personas que han superado una infección y han desarrollado a una respuesta inmune. Los resultados de las pruebas de anticuerpos nos avisan sobre la gente que no son susceptibles a la infección y pueden regresar al trabajo. Esta prueba también podría determinar quién puede donar plasma, el líquido que está en el sangre. Con eso podemos ver un posible tratamiento para la gente que están gravemente enfermos con COVID-19. Aunque estamos trayendo pruebas de anticuerpos a Illinois, nuestra mayor prioridad en este momento es obtener las pruebas que realmente detectan el virus. Como el gobernador mencionó, IDPH está respondiendo a la falta de materiales cortos para pruebas con el desarrollo de más plataformas de pruebas. Eso reduzca nuestra dependencia en los laboratorios comerciales. Es importante saber dónde hay un gran número de casos en Illinois para que podamos tratar de hacer esfuerzos más específicos para detener la transmisión. Hoy estamos informando un total de 15,078 casos, incluyendo 462 vidas perdidas por COVID-19. Este es un aumento de 1,529 casos y 82 vidas perdidas desde ayer. Las noticias están tristes, pero parece que los números no están creciendo tanto como antes. Digo esto todos los días. El distanciamiento físico funciona para reducir la transmisión del virus. Están trabajando, no paren. Quédense en casa. Si tiene que salir, manténganse a 6 pies de distancia a otras personas. Usa una máscara y lávese las manos con frecuencia. Pero lo mejor que puede hacer para usted, su familia y su comunidad es quedarse en casa. Gracias. And with that, I am happy to turn it over to the Chief of the Division of Laboratories for IDPH, Mr. Matt Charles. Sorry.
Good afternoon, and thank you, Governor Pritzker and Director Ezike. I'd first like to thank the Governor for helping our IDPH and Illinois laboratories to ramp up COVID testing. Although the labs have done extraordinary work to source hard-to-find materials and look for creative solutions to supply chain issues. It's through everyone's hard work that we've been able to continue despite the many challenges to obtain laboratory supplies that are being seen nationally. As the Governor mentioned, IDPH has been working closely with our commercial and hospital laboratory partners to ramp up capacity within our state. IDPH has engaged hospital and commercial laboratories to assist with validation samples and advice for successfully operating COVID-19 tests. But beyond working with our other laboratories, IDPH has been working around the clock to further develop our own state public health laboratory capacity to test more specimens per day. Our public health labs have been working hard on test implementation, method improvement, and evaluation since the early phases of this pandemic. Our top scientists within IDPH continuously evaluate criteria such as sensitivity, accuracy, precision, to ensure we are delivering high-quality results as quickly as possible. We're also developing automation to ensure that the testing is performed reliably and results are provided quickly. Right now, the average turnaround time from specimen collection to patient report is approximately 2 days at the IDPH laboratories. And that's inclusive of the time needed to ship specimens by courier or to get them to our laboratory and actually produce the results. So we're working around the clock, 7 days a week, to make sure we can provide both the capacity, quality, and timeliness that are necessary to make the best public health and clinical decisions for Illinois. Thank you. I'd like to introduce and welcome General Neely.
Thank you and good afternoon. Thank you again, Governor Pritzker, for the opportunity to join you today. And I'll tell you, it's incredible the amount of leadership that you've shown during these challenging times, and we really appreciate that. Dr. Ezike, every day coming up here with these difficult numbers, she's really shown strength, and it's refreshing to see the strength through her religion. And as a man of faith myself, I see the difficult times that we're having, and you know, during this Holy Week gives us an opportunity to look elsewhere for our strength, and hopefulness in the future as we move forward through these challenging times. Today, the Illinois National Guard continues to play an important role as we support the doctors, the nurses, the medics on the front line of this response. Today, we have more than 575 guardsmen, both Air National Guard and Army National Guard, engaged across the state supporting the COVID-19 response. These efforts range from testing facilities at Harwood Heights and Bloomington, Illinois, along with augmentation of emergency operations centers around the state, within our counties and at the state level, the support of the Stateville Corrections Facility, as well as assisting in the build-out of the alternate care facility that is being established at McCormick Center. In that vein, today I'm happy to announce that the Illinois Air National Guard will have 2 C-130 cargo aircraft from the 182nd Airlift Wing in Peoria move 250 negative pressurized tents from Eugene, Oregon to Chicago this evening. This effort is truly a whole of government approach to ensure the very timely delivery of these negative pressurized tents in parallel with the build out, the really expeditious build out of the McCormick facility. This will be the first of 3 deliveries over the next few weeks as the Army Corps of Engineers and Walsh Construction complete the build out of McCormick Center. With that, I'll turn this back over to Governor Pritzker for any questions.
Thank you very much, General. Happy to take any questions from in the room and then online.
Governor, there is some discussion today that the CDC is considering changing its guidelines for self-isolation, making it easier for those who have been exposed to return to work if they are asymptomatic. What is your take on that?
Well, you heard Dr. Ezike talk a little bit about this. This is important, an important development. First of all, it's taken weeks and weeks for a determination to be made, and the CDC is acknowledging it now, that if you've had COVID-19, there is a high likelihood that you are immune from getting it again. Unless it mutates or there's some other development of it, COVID-19, once you've had it, you cannot get it again. That's the acknowledgement I think that the CDC is making here. So that's good news in many ways, at least for people who've had COVID-19 and have recovered, that they are not under the same restrictions and guidelines that others who haven't had it yet are. Now, what we don't know, and I need to read more about what the CDC may be saying about it, is whether someone who has had it can also somehow on their clothing or in other ways carry the virus with them, right? So even if somebody is immune from it, is there any way for them to carry the virus with them? I do not know the answer, and I can let Dr. Ezike answer if she does, but I can just tell you that we look very much at this research. We've been looking at it for weeks now, that this will help us going forward with the restarting of the economy. The idea that there will be people who've gone through the horrible experience, some less horrible than others, but the tough experience of having had COVID-19, surviving it, and then we'll be able to do much more than people who are held under today, under stay-at-home and other orders. So we're going to look very much at how we would accomplish what they're suggesting. You know, because it's very hard to just look at somebody and know whether they've had the test or they haven't had the test. You can't tell the difference with somebody. So how would we identify somebody who has had COVID-19 and recovered, rather not the test, but had COVID-19 and recovered? It would only be if they had a test and some showing that they're immune. So Doctor, do you have anything to add to the?
Yeah, I mean, again, I haven't been on email yet, so I know there's updates frequently, but in terms of immunity, I have had discussions with Dr. Jay Butler, the Deputy Chief for Infectious Disease, and I have had this conversation in terms of, you know, if you have somebody who we think has had the disease, we're assuming that they have developed antibodies, that they now have immunity, doesn't that then mean that they would be immune? And we think, and so there was some still, you know, studies going on. Again, I have to remind everyone over and over that When we call this the novel coronavirus, it's because although we've seen many coronaviruses before, like, it's not sharing all the same properties of SARS. It's not sharing all the same properties of the coronavirus that we associate with the common cold. And so some of the assumptions that we make, thinking, oh, this was like SARS, have not borne out. So trying to assume things based on what we have learned in the past from similar viruses is appropriate, but as we get more information, that can change. And so I'm happy to look at the guidance and speak to that more going forward. But we are excited about antibody tests that could tell us, in terms of transmitting the virus, we still know, we've always said that, clean, frequently touched surfaces. So there absolutely is still the risk of someone, even if they were personally immune, of them touching the virus, transferring it to another surface where somebody could pick up. So the donning of gloves would absolutely still be necessary, but I will look into the actual guidance and see if there's more to add.
Thank you. Could you also a little more elaborate on the Abbott rapid tests? The feds, you said that they sent them to private systems without state input. Do we assume that that's hospital? Where did they go?
Yeah, those tend to be either private labs or directly to private hospitals. And essentially they've kind of waylaid them away from states and toward those private entities.
But they're still, I mean, obviously
They exist,
They
and
exist.
some of them come to Illinois too. Just to be clear, it's just that this is what I've talked a lot about the supply chain for everything during this COVID-19 crisis, and this is just another example of the unsteadiness of it. When typically in a normal moment in a supply chain, you place an order. And your order arrives. At some point, you have a date that's, upon which it's supposed to arrive, it's due to arrive. Well, that date comes in this supply chain situation for a lot of things, and the federal government waylays it sometimes. We heard that about Massachusetts and PPE, and now we've heard it, we've seen it with regard to machines. Look, some of those machines will end up in Illinois, and so that's good. But not what we had expected, and we won't have as many as we expect.
Could, the mayor today put in a curfew at 9 p.m. for liquor sales. Could you imagine that statewide as well?
I think that's up to local mayors and local city governments and county governments to make the decision about.
Governor, there are a lot of people who died, a lot of funerals that are being planned, and people are trying to follow social distancing guidelines. But is there anyone who's going to be monitoring that? Will it be the National Guard? Will it be the local police? If people have those kinds of gatherings, and perhaps there may be more than the suggested 10 people that are in attendance?
Look, as I've suggested, we are asking people to do the right thing, even in those circumstances, as difficult as that is. And if somebody is purposely thwarting the order, that suggests that people, it can't gather in numbers of more than 10, then it's appropriate for law enforcement or others to try to break up those gatherings. But obviously, a funeral is a very difficult circumstance. We would ask that pastors and other faith leaders do their best to set different schedules than they normally would for people to come do visitation and for there to be a service, that services really be just for the family, hopefully a small group of people at one time.
Governor, can you comment? There's a report out that, according to the Army Corps of Engineers, McCormick Place will be accepting patients in quote, the next day or two. Is that indeed the case?
I think I'd like to turn that over to General Neely, whose team has also been involved at McCormick. I'll simply say, though, from my perspective, I think it will be more than a couple of days. When you spin up the beds, you also have to make sure you have the proper staffing for all of those beds. And so some of that staffing comes in at different times, right? We're phasing the staffing in because it isn't like you can, grab hundreds of people all at once and have them, begin working all at once. That's a very difficult thing to do. So we're phasing in the staffing, and that means phasing in the number of beds that you might be able to occupy. But as far as what the first date upon which someone might be there would be, I will tell you this. It only happens if they are transferred there from a hospital that is overflowing for lack of beds. So that's the only way. You don't go there as a measure of first resort.
Do you anticipate by next week?
perhaps?
Again, it depends upon, as we are climbing this, toward a peak, it's very difficult for me to tell you exactly, but, you saw the hospitalization numbers we put out yesterday. It gives you some idea of where we are. It depends on whether you think in Chicago hospitals, if 15 or 16% availability of ICU beds is going to force at the regular hospital bed hospitalization numbers a need to transfer people out in order to make some of those regular hospital beds into more like ICU beds. And then you'd need to take over some of the beds that, that are not for ICU patients. So I don't know if General Neely has anything to add.
Well, so a lot of construction going on, a lot of different things, as the governor just talked about, occurring at McCormick Center. And of course, Dr. Ezike is the one that really understands. About with the beds, but I talked about the negative pressurized tents that will really help out in the acute section. Last week, we saw the governor and the mayor cut the ribbon at the McCormick on the 500 beds that were first established. All that is coming together as we pull staff together, train up staff, and we work on things like pharmacy, right? You have to have a pharmacy up and operational, and so we're going through all those important dealings with making sure that that's prepared, the licensing and all those kind of things, as well as training. So it would probably be sometime next week. I'd hate to put a date on it, but Dr. Ezike may have something more in detail.
Could you also, originally it was low to mild. Why do you need those pressurized tents? It sounds like you're going to have more acute patients.
I can answer that. No, the hope is not, but you want to be prepared. And so the idea is to have an area for patients who come in, they're COVID positive, but hopefully at a low level, low acuity, right? And unfortunately, some of them will increase the intensity, the seriousness of the effects of COVID-19. And to the extent that they get to a point where they really need to be moved into a more negative pressurized environment so that they're not infecting others, or so that they get a higher acuity care, that exists there. But again, it's kind of the backup for the lower acuity hospital beds that are being put in. Those lower acuity ones are the ones that are done now, the ones that we unveiled a few days ago. And as the general said, the Illinois National Guard, which is just an amazing organization, is going to Oregon to pick up those tents, which will allow us to have those higher acuity beds available.
Just one follow-up with Dr. Ezike on the exponential growth you said seems to be slowing. Where does this suggest we are in terms of the peak? And also, how can we be sure if we're not testing the 10,000 per day?
Yeah, so I appreciate that. So using the information that we have, we can still track our rate of rise. And so with the decrease in the rate of rise, with it not looking exponential, with it looking more linear, that just means that there's a slower rate of increase. And so we are confident with our team of epidemiologists that that is what we're seeing thus far. So we're with guarded optimism. We're hoping that we're getting close to either the peak or the plateau. It's not clear yet how long that would be. Again, it's really hard to start making specific days, like we're X number of days from the peak, but we think we're heading in that direction, and we will continue to follow the data and give you more as we get it.
Dr. Ezike, a question for you. Up until yesterday, IDPH, the data on the tests was reported as number of people tested. Now it's number of tests. So which is it, and why is there a change? Is it true that sometimes multiple tests are needed to get a result?
So if you recall, when we used to talk about the specimens tested, we know that we used to take a nasal swab, like we had an nasopharyngeal swab, an oropharyngeal swab. So sometimes people had up to 3 different swabs from the same patient. We have now switched to doing single swabs. So I think depending on which data you're looking at, you have to correct for, there may be multiple swabs for an individual. And so I think that's why the correction was made
But
there.
for the most part, it is one specimen for one test now, because the guidance has changed. A lot of the things that you were measuring a month ago are different now because the CDC has given different and new guidance, or the FDA. And so it used to be the multiple swabs for a single person, almost 3, I think, at the beginning, and now it's really more like 1-to-1.
Also received a question, are Illinois hospitals still allowing family members to accompany a woman in labor, and what are the guidelines?
Yeah, so I've been following that, and it's not consistent. It's not a single rule for all hospitals. I know that in some hospitals, they are allowing the partner or the coach be there for the actual labor, but not for any additional time. Again, understanding the situation we're in, but knowing that people coming from the outside can bring, the virus into the hospital. So I know that some hospitals were allowing just the one partner or coach to assist with the actual labor, but not outside of that. And there may have been some other hospitals where that even one person wasn't allowed. So I know that there's not consistency.
We'll do one more in
throughout.
the room, and then we'll go online.
In Los Angeles, the mayor has ordered, if you are at a retail store, wear a mask. Is that a good idea?
It is a good idea. It is a good idea. When you
order
go out and, we haven't ordered it, but as you've said, every day, I wear my own mask when I go outside. If I'm going to a store or any other place, I would wear a mask. I would suggest that for everybody. I've seen a lot of people doing just that, which is terrific. There are some people who aren't yet doing that, and I would suggest to them that certainly, if you are not walking alone, if you are going into any place that has multiple people in it, just for their protection, for the other people's protection, not to mention your own, it is the right thing to do. Yep.
Some questions from online. You've talked about the Wild West of securing PPE outside the government, but what is it like working with the feds? Is it organized, and or do you feel like you're getting the runaround?
So it's a great question because, when you say the feds, when someone asks the question about working with the federal government, there are so many different parts of the federal government. When you're talking to the Army Corps of Engineers, this is a highly organized, highly effective organization. They deliver. When they have promised things, they've delivered. It's really quite amazing. And when you talk about kind of the more political branches, right, like the White House, it's less the case, as you've heard me say before. But look, it is often difficult when people are promising things and then they don't get delivered. And whose fault is it? I mean, if someone makes you a promise, but it's supposed to be delivered by somebody else, where in the executive chain of command did that fall down? I don't know. What I know is a promise was made and then it wasn't delivered. But I will tell you that every time I have interacted with people on the ground who come from the federal government, who are working hard, for Illinois, I mean, I've been really amazed at what they're doing for us.
A new projection from the University of Washington model shows cases in Illinois won't be as severe as originally feared. They also project hospital beds and intensive care beds will not face a shortage. Do you find cause for optimism in these numbers, and do your models show similar information?
The models that show that the death rate might be lower than expected, that the hospitalization rate might be lower than expected, gives me optimism. There are equal number of models out there that show something different. What I can tell you is that we look at multiple models for the state of Illinois. When I see that the IHME changed its numbers, I, of course, go back to the modelers in the state of Illinois, University of Illinois, some of the private consulting firms that have done work, and ask the question, what changed? Why did they make a change? And sometimes there are good explanations, and they're in agreement with one another, and sometimes not good explanations. So overall, though, I'm, as Dr. Ezike is saying, and she has presented this in private as well, there are reasons to see glimmers of hope here in the numbers. There used to be there's a kind of a coefficient that gets used in these models about that's very important for determining, peaking and resource necessary to address COVID-19. It's how many people does a single infected COVID-19 patient infect, right? Because that will determine ultimately how many new infections there will be, and then that leads to how many hospitalizations, how many ICU beds, how many vents, and unfortunately how many deaths. So that number by itself, if you change it by 0.1, one direction or another has an enormous effect on all of the rest of those numbers. But if you talk to Dr. Ezike, you'll see that early on in this development of COVID-19 in Illinois, there was a coefficient that was like 3.5 people were getting infected for every one person that you could detect, and it's much lower now. And again, it's not an exact science, that number, but we are seeing a change in those numbers, and it has directly to do with the orders that we've put in place. People staying at home, people washing their hands, people doing the right thing, people wearing masks. These all have an effect on the infection rate in the state.
This question is for Dr. Ezike. It seems likely that downstate Illinois will see cases peak sometime later than the Chicago area. To what extent are rural critical access hospitals prepared for the increased volume of cases they're likely to see?
Right. So we know that there's the population density will affect the rate of spread, but we also know that they have a shortage of hospitals and beds there. So we're keeping a close eye on that as we look. Right now, I think our hotspot is more northern Illinois and our regions 7 through 11, but we're keeping an eye on all the beds, the ICUs, the ventilators, and the availability of those. And we potentially will have to do some moving of things, but we are also looking at what the needs will be there, and if we need to create some of these additional alternate care facilities in some other regions, like we will be looking at that. So we monitor all of these numbers through our EM resource multiple times a day, and we'll be keeping up with what's going on in the southern region as well.
How do you feel when you see shops and restaurants closed, maybe forever, because of your decision?
It's devastating. It's devastating for the people who've closed their businesses. It's devastating for the people who worked at those businesses. I hope that those shops will not close forever. I hope that the small business loans that we're offering in the state of Illinois, that the small business support that's coming from the federal government will allow those businesses to survive, to reopen when it's time. We're doing our best. I am lobbying. I mean, every day I'm talking to federal officials, federal elected officials, to get them to do something in a stimulus fashion. There's going to be another CARES Act, I'm told, to expand support for small businesses as well as for individuals across the country. And so we want to do everything we can to help those people. But if you want to know how it makes me feel, I know how hard it is to start a business and to make it initially successful. Many small businesses get started, they don't get very far. The ones that do, survive by working 18 hours a day, 7 days a week sometimes to make it. And when they finally make it, I mean, the idea that a virus is going to devastate your business, not something anybody could ever have imagined. But here we are, and we've got to stop the spread of this virus. We've got to save lives so we can save livelihoods.
This will be our last question. Canada radically streamlined applying for unemployment insurance by choosing to check for fraud and errors after processing the application. Folks are applying in 3 minutes and getting direct deposits in 3 days. Could Illinois do something like this?
In fact, we have streamlined that. We've taken away the obstacles. There had been a number of checks that somebody would have to go through before getting their unemployment insurance, a card, and we've actually reduced the numbers of those checks so that people could get approved much faster.
Thank you, everyone.
Thank you.
Thanks for watching, and if you haven't already, please consider subscribing to our channel. And while you're at it, please leave us a comment. Thank you for watching.